But the key thing is, why do we worry about new virus versus old virus? We worry about it because the virus changes, it escapes immunity, it becomes more severe.
So I think there are a number of myths. The first myth is that this is a new virus. Over the last few years, and I would say even in our country, we've become more aware of virology, especially the general public, thanks to COVID. And also, there are a large number of labs now which are testing for new viruses. We are picking up new viral infections, which we were not looking at in the past.
It's mutations which make the virus more virulent, as it happened with COVID, that has led to panic. Now, people are thinking that this is a new virus which will mutate and it will lead to the same kind of condition which happened during COVID. It's more of a nightmare, more of a deja vu.
Viruses, when they replicate, mutations are the norm. Even for the last 2, 3 years, even with Omicron, what you've been seeing on SARS CoV 2 is exactly this. It mutates to escape the immunity to some degree, keeps circulating. It does not necessarily mean that the virus becomes more dangerous.
But this virus doesn't behave in that same manner as COVID 19 does. But it does not mutate that rapidly, and it's not going to really cause more severe illness because of the type of mutation that we saw with the coronavirus.
It won't lead to increased severity or hospitalizations. This is a virus which has always been there. It's just that we didn't have the diagnostic tools earlier. And since there is no increase in the numbers, it is not viable to have a vaccine against it. Nobody is really working on it.
It has been growing in humans for a very long time. So when you look at SARS CoV 2, there is a date before which you will never find a specimen of SARS CoV 2 in humans. This is a virus that's been with us for such a long time that we have all adapted to each other, and it's not a particularly dangerous virus. It cannot suddenly change its stripes.
Even with mutations happening, it is a norm with most of the viruses. It's not going to lead to something which will make it really, really fatal and increase the mortality rate. But see, you never know. Any virulent mutation can sometimes change the nature of the virus, but you can't ignore it completely. We have to be prepared for any eventuality.
Whenever you have any large collection of people, whether it be the Kumbh Mela, whether it be election, you need to be a little vigilant in terms of that area not being a cause of an outbreak.
Yes, the percentages of infections could increase. Yes, we might see more or less infections this year, but we are not going to see the public health system come under threat because of this virus. Is this a message that we don't need to worry about pandemics? Absolutely not.
Hello and welcome to HT's weekly talk show, The Interview. This talk show has taken our viewers through different segments focusing on people, politics and current affairs. During COVID-19, we did some exclusive content interviewing experts and doctors on various aspects of the pandemic. We now bring you a new segment, Health with HT, wherein we will discuss issues ranging from cancer, viruses, disease, diet, vaccines and well-being. And this we will do through a panel of specialists, experts and doctors. For starters, we will talk about what is top of the mind, HMPV or Human Metapneumovirus. Tough to pronounce and equally difficult to decode for an average person. More than the virus, it is where it has been detected that is causing concern. China. Yes, China, where COVID originated. Therefore, the obvious question, is this the next COVID? Will the world face another calamity? Is disaster on the anvil? Or is this much ado about nothing? I will ask this and much more in this edition of our new segment, Health with HT. Before we begin, let me introduce our distinguished panel. We have with us Dr. Randeep Guleria, Chairman, Institute of Internal Medicine, Respiratory and Sleep Medicine. A former director with the All India Institute of Medical Sciences, Dr. Guleria was the key person to lead the centre's response to the COVID pandemic. Let me also introduce Professor Anurag Agarwal, Head, Centre for Digital Health, Ashoka University. During the COVID pandemic, he led the discovery of the Delta variant and has served as chair WHO Technical Advisory Group for Viral Evolution. And Dr. Romal Tikku, Director Internal Medicine at Max Healthcare. In the forefront in the fight against swine flu and COVID 19, Dr. Tikku was handpicked by the government to frame guidelines for management of swine flu. Welcome to the show, Dr. Randeep Guleria, Professor Anurag Agarwal, and Dr. Romal Tikku. And thank you for being here with us.
Pleasure to be here.
Yeah, thank you. Thank you for calling us.
Thank you. Thank you.
I know all of you will contradict me if I describe HMPV as a new virus. So let us first set the record straight, and then I would request each one of you to decode this for me. 1958, 2001, and now 2025. So we could start with Dr. Guleria.
Thank you very much for inviting me. And as you rightly said, this is not a new virus. This virus has been around for some time, reported in 2001, but retrospective data suggests that it was there even before that, for maybe 50 years or so. There are a number of studies from our country itself, from AIMS itself. There's a study by ICMR from UP, there's a study from JIPMER also, and many studies which have reported this virus even in the past, in the last 15, 20 years, as far as India is concerned. So even for our own country, this is not a new virus. And we know that it causes influenza-like illness more in children, but also in adults. And one study even from AIMS showed that even among normal people, there was some degree of protection because there was immunity already present. There was the serological study showed some antibodies which were already present in people who had been there. So there is enough data to tell us that this is not a new virus and we've all been exposed to this virus. But we all know that during this time of the year, during the winter months, we do have outbreaks of viruses, and this is what is happening with this virus.
Professor Agarwal, let me request you to decode the dates 1958, 2001, and now 2025. The significance and what is the continuity pattern?
2001 is the date when it's found. Then you can go back in time and then you can follow the virus forward in time. So, what Dr. Guleria very correctly said is that virus was found about 25 years ago. When you look back, you can see it has been around, and you can do that based on antibodies much before that. And we've been tracking mutations and genomes for the last 20, 25 years, particularly in the last some time when genomic surveillance has become very clear. It's the nature of respiratory viruses to evolve slightly. So you have seen some changes in the virus from time to time. And for example, there's a 111 amino acid area that gets duplicated. And these duplications can help you evade immunity. And then you see some types of this gain prominence compared to others. But there's nothing new about it. All this has been happening. So even this evolution of the virus is not really a new phenomenon. It's a circulating virus that evolves like any other virus in the face of host immunity.
But 1958 was when it was first detected?
No, so the way it works is when you isolate a virus, you culture it, you grow it, you type it. If you want to go back in time, you can find either some degree of genetic evidence, or more commonly, you look at old samples, you look for antibodies, neutralizing antibodies that you can find to currently cultured virus. So you will not have the resolution when you go backwards in time that you do towards the end of this. So it's not possible to trace the evolution of the genome from the 1950s to now. That's much more recent. But the key thing is, why do we worry about new virus versus old virus? We worry about it because the virus changes, it escapes immunity, it becomes more severe. In this specific case, there is no evidence anything like that has been occurring.
But it was discovered in 2001, if I'm not wrong.
Yeah.
And
Yeah.
would
So
the word discover be right?
So, we discover many things in nature that have been around in nature much longer than we've been around. So, as much as in science we call that discovery, that is there. So, we first description perhaps might be a more appropriate word. Discovery might be for new science. This is a description.
I don't want to talk about the symptoms, the hand hygiene, and masks, and so on and so forth. But I do want each one of you to explode the myths surrounding this new virus, as we call it, and nothing new about it, as experts like you say. Dr. Tiku.
Well, as far as I'm concerned, I would consider it like any other flu-like illness. It's just mutations which make the virus more virulent, as it happened with COVID, that has led to panic. Now, people are thinking that this is a new virus which will mutate and it will lead to the same kind of condition which happened during COVID. It's more of a nightmare, more of a deja vu feeling where people are panicking because they think that it's a new virus which has come out of China and it's going to lead to a spike in the number of cases. It will lead to more hospitalizations. But the fact of the matter is that it's just another virus which causes a flu like illness, as Dr. Guledia rightfully said, more so in children. And even the complications happen usually in younger children. And that also happens to people who are immunocompromised. But otherwise, it leads to mild illness.
Dr. Guleria, what are the myths which need to be dispelled?
So I think there are a number of myths. The first myth is that this is a new virus. This is not a new virus.
Average people like us are saying it's a new virus. All of you are saying there's nothing to
So,
worry about.
so let me try and explain that or expand upon this. Over the last few years, or I would say even in our country, we've become more aware of virology, especially the general public, thanks to COVID. And also, there are a large number of labs now which are testing for new viruses. So, both awareness and the fact that we are testing for new viruses, we are picking up new viral infections, which we were not looking at in the past. I remember 20 or 30 years ago, people used to tell me that influenza doesn't exist in our country because of the fact that we are a tropical country. It's only a disease of temperate climates. I used to tell them if it can exist in Hong Kong and Singapore, why can't it exist in India? But when data emerged and we had a pandemic, the H1N1 pandemic, so people still feel that it's new because they haven't heard of it before. The first myth is that just because you haven't heard of it and the scientific community has not raised it doesn't mean that it doesn't exist. So it has been there, and like I said, there are data from our own country which has shown that this virus is present. Data from ICMR from Uttar Pradesh actually suggested that almost 10 to 13% of children who they tested were positive for this virus, even almost about 8, 9 years ago. So that is one. The second myth is that this virus will mutate as COVID-19 did and will develop new virulent strains. But this virus doesn't behave in that same manner as COVID-19 does. So it does not mutate that rapidly, and it's not going to really cause more severe illness because of the type of mutation that we saw with the coronavirus. The other thing to remember is that this is a seasonal infection which happens every year, and one virus or the other usually tends to dominate. This time in China, this is the dominating virus, and that's why you're getting more reports of this virus, the HMPV virus. But if you look at data from WHO from other countries, there are some countries where the influenza outbreak is more as compared to what we're seeing with this virus. So, depending upon countries, you will have some viral outbreaks during the winter months, and that is a natural phenomena which will happen every year. That there will be some outbreak of a virus which may be mild, it may be more severe. It seems to be a little bit more severe, but WHO itself has said that this is not really that much out of the ordinary.
Professor Agarwal, would you like to add to that? And while on mutations, let me ask you what are the chances of mutation? Because it can cause problems. And if viruses see mutations, and there is this recent study, I would say recent, in Puducherry, which has identified the A2 lineage. And with mutations, will hospitalizations increase?
So it's a respiratory virus, and viruses, when they replicate, mutations are the norm. What happens is if any of those mutations give you an advantage in terms of survival, you will find a particular group emerge, and that continues over time. So, what the Puducherry paper, for example, from 21 to 24, talks about is A to A to B, and that's you can call them 2.2, 2.1. That's another way of calling the same thing. Fundamentally, these are nucleotide duplications that occur of a size of either 111 or 180. And what people show is that some of the proteins on the surface change, most likely where the antibodies are hitting the virus, which allows them to escape from the immunity a little bit better. And this is normal. Every virus, including the flu virus, including everything else, undergoes these changes. And even for the last 2, 3 years, even with Omicron, what you've been seeing on SARS CoV 2 is exactly this. It mutates to escape the immunity to some degree, keep circulating. It does not necessarily mean that the virus becomes more dangerous. Now, that type of dangerous mutation more commonly happens when a virus that is adapted to a different animal suddenly acquires a new mutation and jumps to the humans for the first time. Humans typically would lack immunity at that point against that particular virus. The virus may show new behavior it has not previously shown, and that's more like the type of pandemic we worry about. This is not that type of a virus.
What is the evidence to say that and rule that out?
It has been growing in humans for a very long time. So when you look at SARS-CoV-2, there is a date before which you will never find a specimen of SARS-CoV-2 in humans. When you look at some of the animal flus that jumped over to humans, before that particular date, that flu did not exist in humans. This is a virus that's been with us for such a long time that we have all adapted to each other, and it's not a particularly dangerous virus. It cannot suddenly change its stripes, so as to say. So there is no reason to believe that the type of mutations we will see will be anything different from the usual reduction of immune blockade type of things, and will not fundamentally change the behavior of this virus, which is a mild influenza like illness, which can be severe in some people who are compromised, exactly as Dr. Tiku said. But this is the biggest myth. Everybody, if they start sequencing of any virus over time, will find mutations. It'll be extremely unusual not to find mutations. So I think we should not give too much weightage to the fact that some mutations came. So the other myth I would like to bust over here is that these cases we are reporting in media, one more case got found, two more cases got found, are meaningless. Hundreds of such cases are happening all the time. This is about 2 to 3% of all infections, even normally. So if you go looking, you will find it. If you don't go looking, you will not see it. Nothing will be different between the two scenarios, except in one case you started looking, so you saw more of it.
Dr. Tiku, would you like to add to that?
See, this virus has been there for years now, as you rightfully said, since 2001. And this winter is not unusual. It happens every year during winter that there's a spike in the number of respiratory infections, whether it's influenza virus or whether it's atypical pneumonia. We see a lot of respiratory infections during winter. Suddenly, this has become a sort of a nightmare for everybody that this is going to behave like COVID, as I said earlier. But this has been there. It has moderate transmissibility. It doesn't affect other systems as COVID or any other virus would. It usually, I mean, most of the adults actually have antibodies since it's been there for ages, and most of the children actually have antibodies because they've been exposed by around 5, 6 years of age. So it won't lead to increased severity or hospitalizations. This is a virus which has always been there. It's just that we didn't have the diagnostic tools earlier. And since there is no increase in the numbers, it is not viable to have a vaccine against it. Nobody is really working on it because it is not a viable option. So there are so many viruses which cause respiratory illness in this season, and we don't have tests for every virus. And since this virus leads to severe disease rarely and more so in younger children and in immunocompromised, so we are not really bothered right now. And it's just because of our COVID experience, everyone thinks there's going to be a spike, there's going to be increased hospitalizations, but nothing like this will happen. Very, very unlikely that certain mutations will happen, which will change the nature of the virus to the extent that a lot of people will get infected at the same time. And we really have to be geared up. We really have to keep our ICUs, our hospitals, oxygen cylinders, everything ready. Very, very unlikely that anything like that would happen. And this virus typically does not become very, very virulent, as Professor Agarwal rightfully said. Even with mutations happening, it is a norm with most of the viruses. It's not going to lead to something which will make it really, really fatal and increase the mortality rate. We are giving too much importance to it because we have heard about it now, and people haven't heard about it. So it's something which is new. People haven't heard of it. So there's a sort of a panic associated with it. But I don't think there's anything to worry.
You know, Dr. Tikku, you used a word which was part of my next question, which was right now. And I underline the word now because there are people and there is a school of thought to say there is no need to worry now. Now, does that mean that the future is uncertain? And would you agree that there is a risk of a hidden pandemic? And I'm addressing this to all three of you.
Well, I don't see any pandemic happening, and I don't think the risk is huge. But see, you never know. Any virulent mutation can sometimes change the nature of the virus. But as Dr. Agarwal rightfully said, we don't see that happening. But you can't ignore it completely and say that we don't have to be vigilant. We don't have to be prepared. See, we have to be prepared for any eventuality, and we have to keep our health care systems ready. We have to have our surveillance networks working, and so that if even if there's a spike, even if the chance of that happening is very low, whether it's increasing hospitalization with the number of beds required. But overall, if you look at the scenario, very, very unlikely that a pandemic like situation is going to happen, especially with this kind of virus, which has never led to such similar infections in the past.
Dr. Guleria, would you completely rule out a spike? Or would you say the future is uncertain and we don't have to worry now?
I think there are two things. One is, are we going to see a pandemic because of this virus? Very, very unlikely. I don't think that we're going to see a pandemic because of this virus, because this is already a human virus. Unless a lot of genetic reassortment occurs and this becomes a novel virus, we're not really going to see that this virus is going to cause the type of cases that we saw during the COVID pandemic. But having said that, I think it's also important to remember that this century has been a century of outbreaks. The last 25 years, we've had two pandemics, the H1N1 pandemic and the COVID-19 pandemic. We've had outbreak of SARS, we've had outbreak of MERS, Zika virus outbreak, and there have been a number of other outbreaks that have been reported. So it's very important to remember that what is happening is that there is a lot of encroachment that is happening on the environment. The human and animal interaction is becoming more. That's why there's a lot of discussion of One Health. And along with that, of course, one is traveling much more. So as you travel, you carry the infection from one place to the other, even during the incubation period. And also, there is a lot of other factors, climate change, which are also bringing in the various issues which promote the spread of these infections. So therefore, there is a one has to be prepared for any outbreak which may happen, and therefore, good surveillance and an action plan for controlling any outbreak is important. Not because of this virus, but I think in general, because the last 25 years has taught us a lot. And unfortunately, we have sort of very quickly forgotten all the lessons that we learned during COVID-19, which is something that we need to keep in mind. Therefore, surveillance for new viruses, an action plan to contain the spread from one area to the other, all of that needs to be ongoing in terms of labs being available to test for novel viruses which may emerge, and a plan in terms of containment. But having said that, if we talk about the current outbreak, I don't think that is going to lead to a pandemic.
Professor Agarwal?
I mean, first I must ditto what was just said. There is always a threat of a pandemic or an epidemic at a low level, but the threat is not from this particular virus that we are talking about today. If at all, you'd be looking towards animal flus that might still be jumping over and are crossing over. Yeah, last year in America, we saw bird flu in cattle. This is where respiratory viruses, where the next pandemic could come from. And the key factors are exactly as what Dr. Greer said. I mean, A, we are encroaching upon environment of animals as we expand senselessly at times. Number two, we are traveling a lot more. So things spread much faster and quarantines are no longer as effective as they used to be. And last, which is also a good thing and a bad thing at the same time, we are living longer. So we have a much larger fraction of humanity now that is old and more susceptible to these kinds of infections. So, with all these factors put together, when we say now, I would be very comfortable in saying that for this particular virus, there is no evidence of a threat now, nor do I expect there to be a threat later. Yes, the percentages of infections could increase. Yes, we might see more or less infections this year, but we are not going to see the public health system come under threat because of this virus. Is this a message that we don't need to worry about pandemics? Absolutely not. I think surveillance is so important today, and we must pay attention to animal flus jumping to humans. Those are particularly important.
You spoke of surveillance, and I take that point. The Union Health Minister, Mr. Nadda, said there is no need to panic. I somehow see that as the government being foolhardy. And in that sense, what do you think is expected from the government?
I think for the leadership to say there is no reason to panic is not a wrong statement because there is panic. On the other hand, the leadership is not saying that there is no need for surveillance. Surveillance is what you do between epidemics. And that's the point I think is getting lost sometimes. Surveillance should go on all the time, irrespective of whether you're having an epidemic or not. It is just a routine matter. And to be very honest, India also does it. And as we discussed earlier, we don't have tests. The reason you don't have tests for a infection that's been around for more than 2 decades is because it has never been a particularly important infection. And so no clinician really feels the need to test for it. And that's the reason we don't have it. If we wanted to make it, we can make it. And today with sequencing, you can pretty much test for anything that you want without any difficulty. And India has plenty of capacity these days.
When COVID gripped India, we had some similar situations. There was the Kumbh Mela and there were elections. This time around, history seems to be repeating itself on both these counts. Kumbh Mela preparations are in full swing, and elections, state elections, are on the anvil. So, Dr. Guleria, shouldn't the government be more pragmatic rather than dismissive?
Whenever you have any large collection of people, whether it be the Kumbh Mela, whether it be election, you need to be a little vigilant in terms of that area not being a cause of an outbreak of any viral infection. I'm not even talking of this. It could be an outbreak of influenza. It could be an outbreak of any other viral infection. And therefore, good surveillance and infection control practices should be looked at from that point of view. So, can you really promote good infection control practices, good awareness among the public that during this time what they should do in terms of cough etiquettes, hand washing, wearing masks? Those would be good things because you don't want that in a large gathering you have an outbreak of a viral infection which causes strain on the health system, especially when it's being done in a place where you may not have the ideal health facilities available. And I think that is something that we need to look at, both in terms of good infection control practices, good surveillance systems, and the health system being geared up to really look after any outbreak which may happen because of the crowds that will gather, like you said, because of the Kumbh or because of elections. Those things seem to be sensible and reasonable things to do.
My worry is words like now, words like currently, words like at the moment. My worry is what is the road ahead?
Nobody's God. Nobody can tell you for sure this is not going to happen. Very, very unlikely. That's the word I would want to use. See, right now, why are we talking about it? It's just the nightmare of COVID that we've had 4 years back. Everyone is talking about it because of COVID. That's why it's getting so much of importance. But you have to realize at the same time that it's very different from COVID.
Professor Agarwal, you were saying something on
Yeah,
this.
we are saying there is nothing that we see that suggests an elevated risk in the immediate future or the near future. But we are all also saying that because of fundamental changes in human society, the risks in general of pandemics that kill a large number of people, create stress on health systems, is greater today than it has ever been in the past.
Dr. Guleria, the key word is China, and hence the alarm and the panic. What are the similarities of HMPV with COVID, and what are the differences?
One was a novel virus. It was a virus which jumped species and developed the ability for sustained human to human spread. And at the same time, there was no inherent immunity among humans against that virus. And that's why that led to a pandemic. None of this is true for the current HMPV virus. It's not a novel virus. It's not jump species. It's been around for some time, and therefore, and we all have some immunity against this virus. Therefore, it doesn't really match what COVID-19 virus or the coronavirus was as compared to the current outbreak that we're seeing. The similarities is that both started in China, but a lot of outbreaks have started in China, and that is not new. We have in 1998 we had an outbreak of H5N1, which is avian influenza. Avian influenza also started in South China and then traveled to Hong Kong. If you go back in history to SARS in 2003, the SARS outbreak also started from China and went on to Hong Kong and then traveled all the way to Canada. Possibly there is more animal human interaction in China that we see in other parts of the world because a lot of their markets have live animals and live birds as compared to other markets. There is a higher chance of viruses jumping species and evolving with time. But having said that, the two viruses and their background is entirely different. So it's different as compared to COVID 19.
Dr. Tikku, would you like to add to that? And Professor Agarwal?
That these are two very different viruses. The fact of the matter is that we're immune to the one, and the other was a new virus to which we didn't have immunity. That was across age groups. Now, this wasn't limited only to children. Now, COVID was happening to everybody. Even young, healthy people have died because of COVID. And it did not only lead to respiratory complications, it was affecting other systems as well. You had cardiovascular issues, you had neurological issues, and the recovery took a lot of time. It wasn't limited to a week, 10 days. People took a lot of time to recover. Reinfections were worse in certain cases, in spite of the fact that they were exposed to the virus. And then there was post COVID. I mean, all that doesn't happen with viruses like HMPV. Now, with COVID, even now I'm seeing people struggling. There's a certain autoimmune dysfunction which has happened to a lot of patients. A lot of patients coming with autoimmune disorders now. Weird sort of rashes. Immunity has gone for a toss. They've had COVID like 2 years back, but the complications are still happening. And so this is very different from what we see with influenza or with HMPV or for that matter, any other kind of virus. This will die down in the next 2 to 3 weeks. You will not see anyone talking about HMPV.
Professor Agarwal, do you agree with Dr. Tikku when he says that this will die down in a week? And somewhere when we were talking, you said there is no fear of spread. So let me ask you, how infectious is this, and are the fears of spread overrated?
So the only if we keep talking about isolated cases being detected, we'll be talking about it for a long time. There is one similarity to SARS-CoV-2 that there are RNA viruses which make them mutation prone at one level, but also less likely to acquire major assortments, which DNA viruses do, which is actually a good thing. So you accumulate small, meaningless mutations more frequently, but large, major shifts become less frequent. So, what determines spread? There are two parts. One is intrinsic tendency to spread, and the other is the lack of immunity in the population. That because it's been circulating in humans, many of us already have partial immunity, which limits the rate at which it can spread. And also, like I said, because it's a fundamentally an RNA virus, we know its evolution. It's not likely to develop sudden shifts. It's not going to suddenly change its behavior.
Dr. Guleria, the fear of spread and how infectious this is?
All respiratory viruses are infectious if we are not careful in terms of infection control practices. You will have cases, but the issue here is, are these cases going to lead to more mortality? Are they going to lead to more hospitalization? And is this going to be more than what we see every year? That I don't think is going to happen. I don't think we're going to see more or a sudden spurt in infections to a large extent than what we see every year. And I don't think that we're going to see more hospitalizations or more mortality this year than what we were seeing in the last few years.
Which means I will not die because of HMPV.
Correct. In a
So,
manner, yes, but obviously people who are having, let's say, children or immunosuppressed people always get a more serious infection, but that could happen with influenza also. Every year about 30 to 40,000 people die in the US because of influenza despite getting vaccinated. So it's not that it's in none of these other viruses cause any death.
Dr. Tikku, will I die or will I live?
No, you will definitely not die. You were talking about the mask and the precautions, and even the flu vaccine. Even though we keep talking about it, not many people are aware of it in our country, and not everyone takes flu shot. I have patients who come to me and they haven't heard of it. There are people who are coughing, sneezing, they have a flu-like illness. They often go for work. I mean, they don't wear a mask. And all this is also very important. Why does a spread happen? Spread happens because you don't take precautions. So, in spite of having gone through COVID, people haven't really learned their lessons. Self isolation, if you are sick, is very, very important. I would be more worried about flu if you ask me than HMPV virus because that's what we see every year. And a lot of people get complications, pneumonia, respiratory failure, elderly end up with ICU admissions, on ventilators, and things like that. That is the message which should go rather than creating panic about a virus which is very, very unlikely going to harm us.
Dr. Guleria, when we were talking, I was asking you about the lack of testing facilities and absence of vaccine, considering this has been there for many, many years. And you said it was not viable. Would you just elaborate? And then, of course, Professor Agarwal and Romil Tikku can add to it.
That's where you're not looking at high mortality and you're not looking at something which is creating a lot of, let's say, worry in society and among the scientific community. Focus on vaccine becomes less, although there has been research in developing vaccine for this virus also. Second is the input from the industry. Does the industry feel that manufacturing such a vaccine would be viable in terms of people taking it because the fear of death? Now, if you say that this virus is causing a mild illness only, and it's something which is going to be self-limiting and it's been around for such a long time, then there would be less interest among industry to develop a vaccine which is not going to cause that much of a morbidity or mortality. But having said that, I think from my point of view, two things are still very important. Developing good vaccine platforms, because as we said, as we see more and more outbreaks, it's important to have good vaccine platforms for any new novel virus which emerges. And secondly, investing in a lot of good antiviral drugs, which we don't have right now. And that is another thing that was something that we lacked during the COVID-19 pandemic also. We were not having very good antiviral drugs which were against the virus, and a lot of repurposed drugs were actually used in the early days of COVID-19.
Professor Agarwal, would you add to this? Why no vaccine?
I do imagine that in time to come, maybe not now, maybe a decade down, we will be looking at uh, wide range vaccines that will target multiple things at once. So, for example, this is part of the family of RSV. RSV is actually quite important in children. And as people build vaccines, rather than building vaccine for just one virus at a time, we will build multi-unit vaccine that will cover a spectrum of pathogens. And this technology is almost there. So I would expect to see within this decade that we will start seeing these kinds of broad coverage vaccines. And when that happens, vaccine to this also will emerge. I don't think an individual vaccine specifically to this would be viable. But I think here I would like to add one note, which is something I believe is important. I think we have seen of late a lot of distrust, misplaced distrust on vaccines, which remain our number one strategy in preventive against these illnesses.
Finally, going forward, what is it that the government, the public health system, the hospitals, and we, the people, should be doing vis a vis these viruses, and particularly this one? Dr. Tiku, are our hospitals geared up to meet this challenge? And what are the lessons learned? And what is it that we should now put in place?
I think we're all geared up as whether it's the facilities, whether it's the surveillance networks, everything is in place. Though unlikely there's be a spike, but if there's a spike in cases, I'm sure we have hospital beds in place, we have ICU beds in place, the oxygen cylinders, or whatever it takes. There's no specific treatment which is required. So all private hospitals, even our hospital, is all geared up. If there's a spike in the number of cases, we have isolation facilities. Everything is available and ready. We have burnt our fingers in the past with COVID, so we all have to be prepared. There should be increased surveillance, increased research happening on it, and at some point, maybe we would even need a vaccine for any other virus like this virus, so which will sort of give us some ammunition against it.
Dr. Guleria, do you see any gaps as far as preparedness is concerned from whether it is the government hospitals, the public health system, the private hospitals, and the government, and we the people?
So I think the first thing, as far as people are concerned, there's no need for panic. Panic and creates more chaos. And the fact that a lot of scientific people have said that this is an old virus and there's nothing to worry about, one should go with that rather than having a panic situation that we're going to have another pandemic. From the policy point of view, things are in place. We need to continue to have good surveillance, both in terms of whether there's a spike in number of cases as far as this virus is concerned, but also in general whether there is any unusual outbreak which may happen, which may be a red flag for something that we need to have containment strategies and surveillance and look at whether we can upscale our hospital facilities if they are required. We need to be vigilant about that.
Professor Agarwal, would you add to that?
Having a better sense of what might be misinformation and what is real information, I think would be better done for the public. The misinformation epidemic is really a big challenge. If at all, if I had to nitpick, I would say if we were continuously sequencing and releasing this data in the public domain, many questions that come to people's mind would be answered even before they came. And this is something that is two-edged. You also require responsible media and public to not look at a mutation and go crazy. And you need a robust ecosystem of surveillance that continuously releases such data into the public domain. Until both sides are fixed, these things don't move forward.
One last word from each one of you, food for thought or a talking point. Professor Agarwal,
Beware of misinformation in the age of social media.
Dr. Tiku,
Well, take precautions, get vaccinated against flu, and wear a mask whenever you're sick.
Dr. Guleria. Final word from you.
So I think there is no need to panic. This is just a virus which has been around for a long time. But infection control practices, cough etiquettes, washing your hands regularly, wearing a mask if you are sick, not going out, and avoid going to crowded places if you have a high chance of getting infection. Those precautions are universal and should be followed even when you're looking at any outbreak, uh, irrespective of whether it is influenza, COVID, or HMPV.
Dr. Tiku, Professor Agarwal, and Dr. Guleria, thank you very much. Thank you for being here with us, and thank you for exploding myths and dispelling fears.
Thank you for inviting us.
Thank you.
Thank you. Thank you, everyone.